As the White House braces for a winter surge in COVID cases, the CDC is learning more about long COVID. A new study shows of the more than 1 million COVID deaths reported from January 2020 to June of 22, long COVID is to blame for more than 3,500 of them. But researchers also acknowledge that number is, in reality, likely higher. For more on this, I want to bring in Dr. Tina Shah. She's a pulmonologist and served as senior advisor to the U.S. Surgeon General from August 2021 to this past April. A warm welcome to you this morning. Just help for our viewers explain what exactly constitutes long COVID. How do you know you have it?
Good morning, Errol. Long COVID is essentially defined as when you've had COVID and you continue to have symptoms in that period of weeks to even months after you've had your initial episode of COVID. And really, long COVID can affect nearly any organ system. So I'm going to list off some of the top symptoms that people have. One big category is in the range of neurological symptoms. You may be feeling a brain fog where it's hard to sort of think. You may have headaches. You may have trouble sleeping. You may even have a depressed mood or anxiety. A second big category is respiratory symptoms. You may continue to have a cough. You may find yourself still short of breath. You may also have chest pain or palpitations. You can have diarrhea, and you can have a rash. So as you can see, long COVID really manifests over a wide range of different symptoms. But the key point is you've had COVID, and there's something that lingers on and can be weeks to months and even going away and coming back.
Pretty remarkable. I mean, each of those can be pretty life-changing symptoms. Talk to us about different risk levels depending on either the strain of COVID or your vaccination status. It's like, once again, it's more evidence that getting vaccinated and boosted at least helps mitigate some of this, right?
That's absolutely right. And if there's one thing we should really remember and take away is that we still need to get our booster. And if we're not fully vaccinated, now is the time to do so, because there's an increased risk of having long COVID symptoms if you're not fully vaccinated. So no matter where we live and what kind of environment we're in, it makes sense to get fully vaccinated. And for those that have had their initial shots and their booster, we're now due for an additional booster, and closely related to also get your flu shot. So that is the main risk factor, not being vaccinated.
It's really important that we put this focus on long COVID as well, because there is criticism the CDC is facing for not attributing enough deaths to long COVID, including in cases where it's made patients more susceptible to other illnesses or perhaps even cases of suicide. What are your thoughts on that? How are these numbers kind of incomplete in a way?
That's a great question, Errol. And I think some of the challenges we are learning as we go and trying to move as fast as we can, putting all the data together. So when COVID first started, we didn't even have a medical code to really tease out COVID more and not even long COVID. And so really the CDC data, and the CDC produced a report that came out 2 days ago, was really based on hand going through death certificates and really looking for those key words of COVID, long COVID, post-haul COVID, and really trying to kind of put it together. We now have a very specific phrase that we use, and so our data is getting more clean. But as you can imagine, since no one predicted COVID was going to happen and be a pandemic, we have data that's not as clear as it needs to be. And I think you're spot on. Every medical expert, especially including those that are in the CDC, say that the reporting of over 3,500 deaths of long COVID is likely an underestimate.
Yeah, we, the human race, have just been put through the ringer with this pandemic over the past few years, and this is just proof positive that we're still gathering data and agreeing on terms as we still move through it. Dr. Tina Shah, we really appreciate you. Thanks for the checkup.
Thank you so much.